Welcome to Intermountain Healthcare's presentation for vendors who manage human cells, tissue, and cellular and tissue-based products, or HCTPs. In this module, we will be reviewing federal regulations and Joint Commission standards for managing human cells, tissues, and cellular and tissue-based products in our facilities. We will specifically review the vendors or your responsibility to properly manage HCTPs. Moreover, we will review the facility's responsibility to properly manage these products to provide extraordinary care to our patients. Human cells, tissues, and cellular and tissue-based products, or HCTPs, are a class of biologics specifically defined by the U.S. Food and Drug Administration, or FDA. HCTPs are defined as articles or products containing or consisting of human cells or tissues that are intended for implantation, transplantation, infusion, or transfer into a human recipient. Any vendor providing Intermountain these products must register with the Food and Drug Administration. Examples of HCTPs include a wide variety of products. Familiar products that are transplanted or implanted in a hospital, surgical center, clinic, or office include bone tissue, corneas, amniotic membrane, cartilage, dura mater, sclera, ligaments, skin, tendons, human heart valves, and vascular grafts. These are obvious examples of human tissue products that are used in offices, clinics, surgery centers, and hospitals every day. However, there are other products including DBM-DBX, embryos, epithelial cells on a synthetic matrix, immune cells, oocytes, semen, manipulated autologous chondrocytes, pancreatic islet cells, progenitor cells, cord blood, and any medical devices made with human tissue and cells. These require the same vigilance for tracking and storing. This list is not complete and should not be seen as all-inclusive, since there are millions of human tissue products distributed each year, and the number of products that contain human tissue continues to grow exponentially. Products that are not defined as HCTPs include vascularized human organs and blood vessels recovered with organs for use in organ transplantation. Xenografts products made exclusively from bovine or porcine sources are not HCTPs. Other non-HCTPs include blood products, minimally manipulated bone marrow, and secreted or extracted products, for example, human milk. These products are biologics that are regulated by other federal statutes. As mentioned, HCTPs are regulated by the Food and Drug Administration and require special handling and tracking from the time of recovery until the implant or final disposition of the HCTP. The ability to accurately track the HCTP through its life cycle ensures that product and its disposition can be easily identified in case of product recalls or market withdrawals. Intermountain has specific procedures for tracking HCTPs in order to provide extraordinary care to our patients. The public health goal of FDA regulations and Joint Commission standards are to prevent the introduction, transmission, or spread of communicable diseases. This is unique to this class of biologics and requires diligence by both the vendor and the hospital who accepts the HCTP prior to implant into the patient. The Food and Drug Administration regulatory framework has defined tissue manufacturing as engaging in any of the following steps: recovery, screening, testing, processing, packaging, labeling, storing, or distributing an HCTP. The final regulations defining the manufacturing of HCTPs, or current good tissue practices, became effective May 25, 2005, and are documented in the Federal Register. 21 CFR 1270 and 1271 regulate the manufacturing steps and the organizations that perform those steps prior to the HCTP arriving at the threshold of the hospital. Therefore, even if your organization does not recover or process tissue, but stores and distributes it from a physical location, you are considered a tissue establishment. The FDA regulations apply if you perform any step in manufacturing, regardless if you are registered or not. Once the HCTPs arrive at the facility, the Joint Commission has developed specific standards for handling, storing, and managing the HCTPs at the facility. These standards became effective on July 1, 2005. Intermountain has integrated the FDA regulations and the Joint Commission standards into a framework we call the Tissue Compliance Plan. In order to properly implement the Tissue Compliance Plan, Intermountain requires collaboration with its tissue vendors. First, we require that vendors that supply HCTP to our facilities meet any applicable federal, state, and local regulations and guidelines for HCTPs. Next, we require that your organization work with Intermountain Supply Chain Organization to negotiate a contract for distributing HCTPs to our facilities. Furthermore, we require that you understand the unique characteristics of the products your organization produces, distributes, and/or represents. We also require that you are knowledgeable about FDA tissue establishment registration, state licensure, and accreditation status for HCTPs you produce, distribute, or represent. We require that you understand how your HCTP product is stored and appropriately distributed to Intermountain facilities. In addition, we require that at or before the time of distribution, you inform the hospital in writing of the tracking system you're maintaining. Please note this can be accomplished through a contract or in the package insert. We require that you only distribute an HCTP from an FDA-registered tissue establishment in a shipping container validated and appropriate for the HCTP. Intermountain will not facilitate the routine sharing of tissue between other hospitals since it is not registered as a tissue establishment. We require that you alert the facility when introducing a new HCTP to the facility. Finally, never take a product directly to the operating room, procedure room, or patient bedside. All HCTPs must be checked in the materials management or the department's tissue compliance manager prior to implant. Failure to follow the facility's process will result in no payment for the product and potential vendor sanctions against the representative and his or her organization. The relationship to properly managed tissue is not a one-way street, and Intermountain has procedures in place to manage the HCTP when ordering, storing, and distributing your organization's products. Intermountain has a policy to only accept HCTPs from vendors that are registered with the FDA as a tissue establishment. In addition, Intermountain accepts only HCTPs where the tissues are recovered or processed by a professionally accredited tissue, eye, or blood bank. For example, the American Association of Tissue Banks or Eye Bank Association of America. Intermountain will credential each vendor and determine if they meet our criteria. The vendor credentialing step is performed when a new product is offered and is renewed at least annually for all vendors. Intermountain has processes in place to properly store, monitor, and track HCTPs from the time of receipt until their final disposition to meet Joint Commission standards. Intermountain will report adverse reactions to vendors for investigation to meet Joint Commission standards. It is expected that your organization will communicate its response and investigative findings as soon as possible back to Intermountain. And finally, Intermountain will return tissue tracking cards or forms to the vendor. This step closes the loop on tracking the tissue from recovery to implant. Intermountain Tissue Compliance Plan ensures that all HCTPs are centrally managed at each facility. Each department at each facility has a tissue compliance officer that is responsible for properly managing the HCTPs. As mentioned earlier, HCTPs will not be shared with any other facilities. Tissues will not be shipped to other hospitals or Intermountain facilities. Since HCTPs are a special class of biologics that require special tracking, HCTPs may not be placed under consignment. Each facility will work with you to determine the appropriate PAR level to meet the needs of the clinician and patient population. All HCTPs must be checked in through the materials management for proper tracking and reimbursement to vendors. Failure to properly check in HCTPs with the facility will result in no payment for the product and potential vendor sanctions against the representative and his or her organization. Intermountain's procedures ensure that HCTPs are logged in immediately upon arrival and tracked by Intermountain using a proprietary Intermountain HCTP tracking database. Finally, all HCTP recalls and market withdrawals are managed centrally through the Tissue Compliance Manager. Vendors should notify the facilities as soon as possible in the event of a recall or market withdrawal. In review, there are federal standards for the manufacturing and special handling of HCTPs from the time of recovery to the final disposition. These include Federal Regulations 21 CFR 1270 and 1271 and Joint Commission Transplant Standards TS 020101 through TS 020301. Vendors have the ultimate responsibility for properly distributing HCTPs to Intermountain facilities. The hospital has the responsibility to properly manage and track tissues from time of receipt from the vendor to the final disposition. Intermountain Tissue Compliance Plan provides our patients with extraordinary care by properly managing HCTPs in all facilities. You are our partner, and we appreciate your compliance. Thank you.